on the inner abdominal wall, we have the parietal peritoneum below the diaphragm, so the peritoneum is the lining. So the visceral peritoneum is just the covering of the organs, or at least most of the organs. So you can see usually the liver is a little darker than this. He had a leaky gallbladder, that's why the green is all around. But we get in there, we have this yellowish type substance that drapes over. This is the greater omentum.
Like this drapes over all the organs?
Mm-hmm. On the anterior surface. So greater omentum. We're going to tear right through the lesser omentum when we get to that. So this structure, it's a little bit bigger than a lot of them, but that's a spleen. Left upper quadrant on us, on the models, it's just kind of an afterthought because it's just a spleen. But this big tongue-like structure, so don't get it confused with the liver because often these two organs look the same. Again, here's our liver. See how fast it is. Then our gallbladder is still on the underside of the liver. It's just kind of tucked up into the lobes. So right in this space, sometimes you have to get back in there. His gallbladder is right out there in front. So the bile is green. So let's just pull up the greater omentum again. Here's our small intestine, all this ball stuff. And then if you pull it out, you can see the large intestine, the colon. It's not quite, it is like ours, it's just the ascending colon isn't as long. But if you look where it's headed to the rectum. That's, yeah, who you're associated with sometimes. You're associated with the rectum, your colon. Okay. So we have this connective tissue. Again, here's our small intestine. This connective tissue that attaches the small intestine to the posterior wall of the abdomen, all that clear stuff. It's the mesentery. Now, if the cat's extra fat, a lot of fat on him, this would be more, it would look more like that yellowish there. So it's not always clear, but it's always attached in the small intestine, the back wall of the abdomen. And then we have the large intestine again. There's this, I'm trying to see here, there's a piece of connective tissue. Again, it's clear in this case. That's the mesocolon. So mesentery attaches the small intestine. Mesocolon attaches the large intestine. So let's see, down here, since we can see it so well in this case, that's our left kidney. Kidney is retroperitoneal, so it means it's behind this visceral peritoneum. This happens to be dyed blue, so we can flip over to the other side, see the other kidney, the right kidney. And then there's our, again, go back to our liver. behind the liver, we have the stomach. So again, this is the deal, doing pictures and doing live things. The colors, the textures are different. So this whole thing is our stomach. All around here. Behind the liver. And then this little dab, it looks like another little tongue, that's part of the pancreas. So most of the pancreas is tucked behind the stomach. The pancreas is retroperitoneal too. It's behind the parietal peritoneum. So it's not actually in the abdominal cavity proper. So again, this is great because as big as he is, he's somewhat lean. So we can see these things. We don't have a lot of adipose tissue blocking here. Parietal peritoneum is just, our lesser omentum is just destroyed. So we got to get somewhere behind the stomach to see the rest of the pancreas. He's not going to give it up so quickly. Fortunately, he gave us such a nice look there. See the pancreas. The pancreas usually looks like if you took lean ground beef and chewed it up, formed it up into kind of a narrow open. That's the pancreas. See it. Kind of anemic ground beef. Right between the fingers, thumbs. Lean ground beef. Not you rich folks, what you eat. So it's somewhat nondescript. But behind the stomach's real big, real laid out. We could cut into the stomach, but usually we won't see the rugae. You can cut into it if you want. So our vessels, this other way. There's our kidneys. So here's the large vessel, our post cava. So the post cava and the renal veins are the easiest ones to find, the ones that stand out closest to the surface or closest to where we're looking. And you see how much fat is around the kidney. And we're all that way pretty much because we don't want the kidneys to jiggle around. you can see the renal artery. The renal vein is kind of tucked in behind, so it's a little bit harder to see. And we could go on the other side. This area in the middle is called the hilum, just like in the long. Yeah. So we can go over here, kind of dig up that parietal peritoneum, that outer adipose layer. And the renal artery is about half the size of the renal vein. I can see it right now. Get the fat out of there. You kind of see it in there. The red is the artery. On this one, don't worry about the iliac arteries. They're down in here. They're pretty deep. You can dig them out, but I never pin those. You can also, while you're doing the kidneys, this isn't on your paper, but you can follow this little tube. If you can find it. There it is. The ureters. See, his bladder is down here. He's kind of a girly man, because you see some of these toms, they have a huge bladder, just paper thin, or it's stereotyping again, but the females is just like a little acorn compared to toms or truck. So again, the bladder isn't on your list for the cat, but we can see the ureters. Show you while we're in that area. It's kind of trapped in the fascia, but there's the ureters. Go from the kidneys, transport urine down to the bladder. And there's one on each side. So they're retroperitoneal too. And then the other thing is, after we pass out of the pelvic cavity, we get into the lower leg. So there's our femoral artery, and the femoral vein will be behind it somewhere. So again, don't worry about the iliac arteries. We'll do the iliac arteries just in the human models. Is there anything else on your list?
You said that the Rugae is not anything?
I won't do the rugae on the cat.